Good morning, everybody.
Good morning. Sonia is checking on Dr. Crowell.
Great. How was your weekend, Susan?
It was good. How about yours?
I think I know how Gabe's was. I talked to him 5 times a day. It was not a weekend, is my guess.
For you guys, definitely not. Ever. I'm checking with the press right now to see if everybody has their ability to record. If you're having any issues, please put a note in the chat to let us know. Paul Lester would like to record from Fox News.
Yes, ma'am. Good morning to you.
Thank you. We'll get you going here in just a second, sir.
I'm working on allowing everybody to record. So.
Thanks, Rashai.
I just texted Dr. Kroll as well, just to let her know we're waiting for him. So hopefully he'll be on soon.
Okay. If you're ready, we're going to go ahead and start. And then when he gets on, we'll go ahead and let him talk and share his latest news. So I'll go ahead and count us in and I'll start us off. 3, 2, 1. Good morning, everybody, and welcome to our media briefing with Council President Tom Hucker and Council Vice President Gabe Albornoz. Dr. Kroll will be joining us shortly. If you're from the media and you have a question for anybody who's on the panel today, please send it to me in the chat and we will go to the questions in order. I'm going to turn it over now to Council President Tom Hucker to start the press briefing.
Thank you so much, Susan. Good morning, and thanks to everyone for joining us today. Today, I'm joined by Council Vice President Gabe Albornoz and our health officer, I believe soon, and Montgomery County's Health and Human Service Director, Dr. Raymond Kroll, will be joining us in a few minutes. Before I begin, I want to send my deepest condolences on behalf of the council to the family and friends and loved ones of Simeon Mukuna. On Sunday, Richard Montgomery High School Principal Damon Monteleone announced that Simeon Mukuna, a senior at the school, had passed away as the result of a shooting in Howard County. He described Simeon as a wonderful student with an amazing sense of humor who loved soccer and made a positive impact on all those around him. We are keeping the entire Richard Montgomery High School community and his family in our thoughts. For today's briefing, I want to begin just with a few comments about our COVID-19 vaccine rollout. As usual, the council's letter to the governor and the response from the Maryland Department of Health, an update on indoor dining and Beltway widening plans, and a few important upcoming council matters. I'll pass it over to Dr. Kroll and then Vice President Albornoz to elaborate on our HHS matters and anything else on his mind. I want to start off with a reminder that the council will hold a virtual commemoration for Black History Month tomorrow at 9 a.m. at the beginning of our council session, and I would encourage everybody to tune in. The theme of this year's commemoration is African American change makers who are leading, healing, and shaping Montgomery County. Tomorrow, we're going to be honoring 5 African American Montgomery County residents whose achievements who have helped shape our county and made incredible contributions to our society. They include County Health Officer and Chief of Public Health Services, Dr. Travis Gales, who has been helping lead our fight against the pandemic, high school senior Avery Smedley, who's an activist using her voice to prove there's no age limit for social change, Reverend Pat Drumming of the Rainbow Community Food Pantry, who's feeding the hungry and spreading positivity and hope in the community, Joseph Hooks the founder of the 480 Club, who gives back through mentorship in sports, and Montgomery College President, Dr. Darion Pollard, who's the first African-American woman to lead Montgomery College. We are all so grateful for the inspiring work that these individuals do, and so many others in our community. This is something we celebrate not just during the month of February, but during every month of the year as we continue to build a more inclusive and equitable future for everyone. Let me begin with a COVID update. So far this month, COVID-19 case rates continue to decrease, which is good news, but of course that's happened because of our vigorous response and the precautions residents have been taking. With new variants in Maryland, we can't let our guard down. Montgomery County has half of the number of COVID cases when measured against the same period in January. Vaccine update I want to share with you. Our Department of Health and Human Services, and Dr. Kroll will obviously elaborate in a moment, continues to vaccinate residents over 75, as well as first responders and others in priority groups 1A and 1B tier 1. We all remain committed to vaccinating our residents as quickly and equitably as possible, but given the current state of the vaccination rollout, we need a lot of help from the federal government and the state of Maryland to make that happen. This week, DHHS is receiving 1,000 fewer doses than we did last week, down to 4,500 doses, down from 5,500, which itself was down from around 10,000 each week previously, which was itself insufficient. We could vaccinate 25,000 or more of our residents every week if the state would just give us the doses. We appreciate the state providing reimbursable payments for local health departments, but we need the vaccinations and help with operational changes as well. The federal government is providing approximately 72,000 doses to Maryland, and DHHS is receiving on average, again, 5,500 to 6,000 doses per week on average, and we were cut to 4,500 this week. That's far less than our fair share on a per capita basis, since we make up about 17% of the state population. Our community has 73,000 residents age 75 or older who must be vaccinated quickly. I do want to add a phone line has been established for individuals who don't have access to the internet or who need assistance to pre-register for a vaccination. Residents can call 240-777-2982 7 days a week from 8 a.m. to 6 p.m. to get assistance with pre-registration. Third, I want to mention the letter to the governor. Last week, we all mentioned to you that we had sent a letter to Governor Hogan on January 28th, asking him to work with the Maryland Department of Health to remedy many ongoing problems occurring related to vaccination registration and distribution that we do not have the ability to correct at the county level. To address those issues, we invited Maryland's acting Secretary of Health, Dennis Schrader, to attend a council meeting to address those issues. And in response, I'm happy to announce that while Acting Secretary Schrader is not coming, tomorrow we will hear from Acting Deputy Secretary for Public Health Services, Dr. Jinlin Chan, Heather Scheck, Deputy Director of the Office of Governmental Affairs, and Dr. Mark Martin, the Deputy Director of the Office of Minority Health and Health Disparities for the Maryland Department of Health. So we're grateful that they're coming, and we have questions for them, and we imagine you might as well. Some of the key issues we'll discuss include consistency of vaccine distribution, coordination among vaccinators, equity in administering the supply, ramping up our vaccinations, fixing the PrEP mod system, and providing information on nursing homes, assisted living, and other congregate settings. We're happy to provide you with both the letter we sent to Governor Hogan and their response. We are troubled about the lack of vaccine uptakes in nursing and group homes and vaccinations for people with developmental disabilities and their support professionals and caregivers. We need to know what the vaccination plan is for our independent senior living communities. We need the Department of Health to clarify and discuss the roles and responsibilities for inspections and remediations of deficiencies related to the inspections across these vulnerable populations. Tomorrow, we'll include the discussion on nursing homes as part of the updates with the Maryland Department of Health. Fifth, I want to mention the update on, provide an update on our indoor dining. Tomorrow, the council will hold a public hearing at 10 and vote on the Executive Order 1921, which we received from the county executive to allow indoor dining at a 25% capacity. The county executive moved the effective date to February 14th at 7 a.m. He extended the indoor dining period to 90 minutes. And continued the prohibition on alcohol sales which ends at 10 p.m. with COVID cases continuing to drop to nearly 5% in all of our neighboring jurisdictions, allowing indoor dining, the benefits of our current status are really eroded by the position of our neighboring jurisdictions. I wish we had a unified regional and statewide status that puts public health issues ahead, but we don't, and so it makes sense to align Montgomery County with some of our neighboring jurisdictions. I'll also mention the call for increased stimulus checks and the relief act that's before the General Assembly. I am grateful to the Maryland Senate for their amendments to Governor Hogan's economic relief package. The House is now taking it up. It's now a $1.5 billion pandemic financial aid package that many of us were involved in calling for shortly before the holidays. I'm glad that the state leadership has improved that package. It still is somewhat insufficient to the historic calamity that we're living through. And I really hope, I've been in touch with many House leaders, I hope they will rise to the occasion to improve upon the Senate's work and vastly increase the direct and immediate cash assistance for our needy families and our small businesses. On the Beltway widening, there has been some news. Obviously, the county has been quite clear about our objections to widening the Beltway, particularly east of the 270 West Spur. We have many concerns about the process and the lack of transparency and the costs that are passed on potentially to taxpayers, both in utility relocation costs and in the pre-development costs that were covered in recent media articles. Finally, I want to mention the capital budget hearing on February 9th. The capital budget is $14 billion. Transportation and school projects make up about half of that. This is FY22 is a biennial year for the capital budget, which means we only really entertain amendments to the capital budget. And a public hearing on the capital budget is scheduled for February 9th at 1:30 p.m. And we look forward to hearing from the community on all those items. So I've shared a lot with you. Let me turn it over first to Dr. Kroll to elaborate on our COVID response, and then to the Council Vice President. Thank you so much. Dr. Kroll.
Thank you, Council President Albornoz, and good morning to everyone. So Council President, you've done a great job of sort of outlining the broad strokes of where we are and giving folks an update. I do want to, in terms of the case rates, I do want to let folks know that we were, back in January, we were at 49.8 cases per day on average, and we're now down to 20.6 cases per day, which is a dramatic drop, and it continues to go in the right direction. So we will have to see whether or not we see any kind of changes in that pattern due to Super Bowl Sunday, which, as you know, has the potential to become a spreader event. I'm hoping that folks in the county were mindful and kept their distance and watched and enjoyed the Super Bowl with safety in mind. We have you've talked about the doses that are available from the state, and to your point, the county's doses were reduced, and we think we do not have a good explanation for why that is the case, and know that we could do more with more doses. The state has continued to add doses to pharmacies and to hospitals, and are beginning in the early phases of standing up what they're calling mass vaccination sites in a couple of different areas around the state, Six Flags and Baltimore County being a couple of those places. The challenge that, as well as, excuse me, I'm sorry, vaccinating in hospitals, sending vaccines through the hospitals to vaccinate across all the tiers that we've discussed. They are vaccinating our educators as well as some of our older residents, 75 and older. Where the state systems are concerned, the registration, and folks will have known this because they will have tried to do this, have been on a first come, first served basis. They are doing a better job of adhering to the tiers and the timelines that the governor set out initially. But because it's first come, first served, those doses tend to disappear very quickly, which means that if you're digitally challenged in any kind of way, or if you're slow, if your fingers don't work as well as they used to, like mine don't anymore, your ability to fill out that form very quickly and get one of those available slots is really challenging. So they do not yet have a call-in assistance line as we do in the county. So I'm not sure quite how they're going to address that. But we are, with you also, with council support and with our state delegation support, continuing to press the issues about improving the process by which people register, as well as continuing to address the equity issues. One of the things that that we are working on, and want to encourage folks to continue to pre-register in Montgomery County. And if it helps, think of it this way. There are a number of different places where you can go and try to sign up for a vaccine. First come, first serve at the state, and most other systems have their own, pharmacies, et cetera, have their own guidelines around this. But the vaccines are going very quickly. Pre-registering with Montgomery County basically guarantees you that at some point we're going to give you a call. This is not something you have to track. So it's a safety valve, if you want to think of it that way. So pre-register in the county. As we continue to get doses and doses are available, we are prioritizing that list and pulling folks every day and giving people a call to say, it's now your turn to come in and be registered. So it's if you want to think of it as a safety valve, you've got one. Whenever it happens, there'll be one that's got your name on it at some point, and not have to chase the vaccine through first come, first serve. We're also working on ways to help residents to maybe register with that state system. So getting some folks that will help our county residents to navigate the state system for registration and get them registered as need be. So I'm hoping that we can do both things. So it's the other thing I will say is that we're also in terms of vaccine access, we're mindful that there are some of our older residents who do have mobility challenges. And so we have begun to identify locations in the county where they live and to work through processes for how we stand up vaccination sites in those areas. We're not there yet, and it is always going to be dose dependent. So it may not be a great volume, but at least we're beginning to think about how do we move our vaccination sites away from the large sites we have to maybe some smaller venues. So we're looking at doing things like having a 75 and up only day in some of our mass sites, as well as locating them in areas where we know the impact has been highest, and then targeting community members, targeting availability to community members in those areas. So hopefully that will be something that we'll be able to pull off in the next week or two. The other thing, we continue to do our outreach and education. Our census team, the group that did such great work in getting all of our county residents to sign up for the census, has now been reformed as the Corona campaign advisors to reach out into those same communities and engage with those same neighborhoods to identify where they're, and in collaboration with our regional service center directors, to identify where we need to target our outreach to inform the community about the availability of vaccine and the need to be vaccinated, as well as work on helping them to gain access to the system, whether it's pre-registration or registration, or covering that last mile to get from wherever they are to a vaccine site. So that work is just now continuing, just now began last week, but we will be ramping it up in the weeks to come. We're in this for a long run, so we're going to need to do a lot of work with our community to help them to be ready and to support their readiness. The town hall you spoke of earlier is one of those examples, and I think there will be other town halls coming up and announced in the weeks to come. So I think that is my quick summary of the report, and I'll stop and let you all continue and stay on with you for as long as need be.
Stay on for all the hard questions, please. Council Vice President Albornoz.
Thank you, Mr. President, and thank you, Dr. Kroll. Both of you did a great job covering the highlights and the most important bases. I just want to stress our appreciation to the Maryland Department of Health for sending representatives to our session tomorrow. All of our council colleagues continue to be inundated with questions, concerns, comments from county residents regarding vaccine dissemination and a lot of confusing messaging that's out there. So it's an opportunity for us to seek clarity on both what is going on, better understand the state's plan, but I think most importantly, demonstrate the importance of collaboration moving forward for us to more cohesively than we have been connect our local and state governments in ensuring better communication, better technology, and an easier process to navigate that leads to more equitable distribution of the vaccines, which is, as we all know, both a moral and public health imperative to get that right. So I'll stop there to see if answer any questions that people may have. But thank you all again for participating in this discussion.
Thank you.
Okay, we do have some questions, and we're going to have Stephanie Ramirez has the first question today. So Stephanie, we're ready for you. Go ahead and turn on your video and your audio and ask your question.
Good morning. I don't know if you can see me. Can you hear me at least?
We can hear you,
Yeah,
but we
you
can't
can.
see you. There you
Okay.
are.
There we are.
Hey, Stephanie.
Good morning, everyone. Hi. Two questions for you. Number one is on the vaccine allotment that you had talked about, how the county received around 1,000 less this week compared to the week prior. I understand there's not clear answers from the state, but do any of you have any reason or concern over the mass vaccination sites potentially taking away from the allotments that the counties are receiving? Any information you could share on that for number one?
Yes, I think we're all concerned. I should probably ask Dr. Kroll to elaborate, but yeah, we weren't getting enough in the to begin with, and obviously this only makes things more difficult, particularly because the two sites that have been identified, Prince George's and Baltimore, those jurisdictions certainly need assistance from the state as well, but it's not convenient to our residents.
I think that's right. I'm sorry, my phones are kind of blowing up at me right now. I'm not quite sure why. Kind of going off for like Christmas bells. The short answer is that yes, they have. We are certainly concerned about that. We are the state sites will do a great job, no doubt, of vaccinating folks who can get access to them and who can travel to them and be available. But it doesn't help us to identify to make sure that folks who can't travel, who are less able to navigate, and who are less able to navigate that digital divide, can gain access to it. So those are both concerns. We know folks will get vaccinated. We think that we certainly have a way of targeting the community and targeting vaccines to communities that have been hardest hit, that we encourage the states to consider as they move forward in all their vaccination efforts.
Just to follow up to that, I understand that the equity issues are very much a part of that concern. But with regard to whether this vaccine's now going to those mass vaccination sites will remove the allotments going to the county, do you have any information to say that that's happening?
I don't. We know what the allocations are and the changes are, and we know that we've got a reduction in allocation, but it's not clear where how the state has not accounted to us for where all of their doses are going. They have, the federal government, as I understand it, has increased the state's allocation from some 70,000 doses a week to over 80,000+, 84, 85,000 doses a week now. It has not yet been made clear to us through our public health officers, or any of the public health officers, as far as I can tell, what their plans are for how they're going to allocate those doses.
And what does that mean for the average person trying to get a vaccine then, who can qualify?
Well, at this point, they are vaccinating in tiers 1A, 1B, and 1C. So they're 65 and older can be vaccinated, and I believe they're also vaccinating 16 to 64 with additional healthcare considerations, as well as 75-year-olds. So people can register there. The challenge at the state systems, the challenge is that they have, as I said earlier, first come, first serve. So whoever has digital access and fast fingers can get those sites and can get those vaccines. And once they're gone, then until they reallocate additional doses, people are out of luck on that site.
Right. And whoever has a car and the ability to take off work and drive down to Six Flags.
Yes.
Sir, I can't hear you. My dog's going crazy. I do have a follow-up question on indoor dining. If you guys could come back to me, I greatly appreciate that. Sorry.
Can do. Okay, the next question is from Randy Bass from WDVM. Randy, you can unmute yourself and show us your video and go right ahead.
Good morning. Thanks so much for having me on the briefing today. Quick question, and I'll have a follow-up. I know some county leaders have expressed their disdain with the current state of the sign-up process. What are your thoughts on the registration process? I mean, in its current state, and we've discussed that a little bit. And would you advocate for a one-stop shop sign-up system statewide? Because right now everything seems pretty disjointed between pharmacies, hospitals, and county-run clinics.
So I think that a one-stop sign-up would be an ideal frame for us to have, provided that it has some considerations for addressing equity in the impact of COVID and the disparate impact in COVID to communities who may not have good digital access to that system, or who may not be able to navigate that system without some assistance. It would simplify things a lot, even if they didn't do it statewide. If they did it at the county level and gave us some flexibility within the county to allocate doses and to do a distribution system at the county level, that would be helpful.
Gabe?
The current registration system is immensely frustrating, and I think is leading to inefficiency. It's leading to inequity, and it's leading to confusion and chaos out within the community that is growing frustration to a level that I haven't seen in 14 years of being in government. And I understand the frustration and anger that people are feeling right now. It is very disorienting. And so a one-stop registration system unquestionably would be the way to go. My concern is that the train has in many ways left the building. And so we are left to trying to consolidate as best we can within this system that we have now. And many of our questions tomorrow to our colleagues at the state level will be around where we go from here and how we do consolidate registration systems more cohesively and more coherently to ensure that people get the best possible care. The good news is that once you get the vaccine, there is a very adept system to ensuring that you get the second dosage of the vaccine. And the other good news is that once you get an appointment and it is confirmed that you are eligible for that appointment, there is a tremendously efficient process, both within the county locations, the hospital locations, and the feedback early on from the mass vaccination locations. So the infrastructure is there. There just needs to be better coordination.
Okay, the next question is from Rebecca Tan from the Washington Post.
Oh, I'm so sorry. Could I ask a quick follow-up? Do we have time?
Sure, go right ahead.
Thank you. My apologies. Follow-up, we know some zip codes were hit much harder than others in Montgomery County. When it comes to prioritizing those eligible populations, is someone who pre-registers with a Wheaton or White Oak zip code being given priority over someone who registers with a zip code from Dickerson or Poolsville? Dr. Kroll, you said people are getting calls. Who gets that call first? Is that part of what goes into who decide? Is that part of what goes into who is being prioritized?
So part of that does refer back to the equity plan that we talked about last week. And the way we've approached this is our goal is to attack this virus where it is most aggressively attacking us as a county. And so we're looking at those zip codes that have the highest rate of infection. And within those zip codes, we're looking at communities where those infections have been greatest, and targeting vaccine distribution there as a priority so that we can cut off the transmission, reduce the spread, and keep those communities from contributing to the ongoing spread across the rest of the county. So we're working on prioritizing zip codes in that order, and then looking at an equitable distribution to make sure that people who might normally not have access and have healthcare disparities historically also have access to those doses as well.
So someone who lives in one of those harder hit zip codes is most likely going to get that vaccine ahead of someone who lives in a zip code who is not. Is that correct?
That is likely the case, yes.
Okay, thank you.
Okay, Rebecca from the Washington Post for Dr. Kroll.
Hi, sorry, I might have missed this earlier, but Dr. Kroll, Dr. Kroll, could you say again what the vaccine doses were decreased by? So how much did we get last week and how much did we get this week?
I believe it was 1,000 doses less than last week. I had the numbers up and I shut them down, so forgive me, but
500 to 4,500.
That is 4,500. It was 5,500 last week, and so 1,000 less would make it 45 for this week.
And this is just first doses, right? The ones allocated for first.
That is first doses. Second doses are treated separately. We get for second doses an amount equivalent to the first doses that we had administered 4 weeks ago. So
Got it. Got it. And a quick follow-up question to that. I'm curious to know, can you tell us what the county is currently doing to prepare for the moment when the county does receive a significant influx of vaccine doses? For example, when the federal government increases supply, what is the county doing to prepare for that moment and to avoid the kind of confusion that we're in right now?
So I think in addition to talking about all the things you've heard us talk about earlier, and a single registration, coordinating with the state, hoping to promote some equity, we are looking at this point, how do we expand? Well, we have capacity to do many more vaccines than we're receiving doses for in this moment, just through the county's existing system. But we're also looking to partner with our minority health initiatives and other providers in the community who can also serve as distribution points for the vaccine, so that when the capacity is there, when the doses are there, we'll have expanded capacity to vaccinate, hopefully, well, much faster than we are now. Certainly as doses come in, we want to be able to distribute them. I'm also thinking that it's also clear that one of the long range plans for this has been that our private provider community, our physicians, would ultimately have access to vaccines so that they could vaccinate out of their clinics, much as in the way that we do flu vaccines now. So as vaccines become available, the state will open up more opportunities for private physicians' offices to access that vaccine, and that'll help with the distribution as well.
Got it. And for the council members, can you tell me what are you most concerned about as the county prepares for more vaccine doses to come online?
Okay, I mean, that's not at the top of my, I'm going to be relieved when we get more doses and not very concerned. I think we're very focused on, we have a great amount of excess capacity. As I mentioned, we could vaccinate at least 25,000 a week if we could just get the doses. We are very focused on doing that equitably and efficiently. We had a very good track record for getting vaccines into arms, better than any other county in the state. And this is a big challenge, but I'm confident in the staff that we have. Gabe?
I would just say two things, going back to a point that was made earlier: the consolidated registration system, so that we can more efficiently and coherently go through the list of people in the various at-risk categories before we can get to the general population, is my biggest concern, is ensuring that people aren't jumping lines, and that we have a consolidated effort, because as been noted, we have the infrastructure in place right now to vaccinate over 30,000 people per week. And we have also been in contact and working on identifying locations where we can do our own version of a mass scale vaccination procedure and process, similar to what has been stood up in Prince George's and Baltimore. So we have the pieces in place, we just need more vaccines.
Thank you.
Okay, our next question is from Marcela Rodriguez from Univision. She has a question in Spanish for the Council Vice President. Marcela?
Hola, buenos días. No sé si me escuchan.
Sí, te escucho, gracias.
Perfecto, ¿cómo está, vicepresidente? Lo que quiero consultar el día de hoy es que ustedes como condado han establecido 8 plataformas de registración que incluye supermercados como el Giant, también centros médicos y el Departamento de Salud. Sin embargo, hay muchos residentes que han expresado un poco de confusión, ya que cada sitio es independiente. Quería saber si ustedes han analizado elaborar un sitio tal vez conjunto donde las personas puedan ver cuáles son las citas disponibles y que el sistema les diga, tenemos disponible en este hospital o en este hospital o en el otro lugar, para no tener que ir a distintos lugares, y porque muchas personas alegan que puede quitarles mucho tiempo o puede llegar a ser confuso.
Gracias por esa pregunta, Marcela. Sí, queremos un sistema de registración unido que no tenemos en este momento. El Estado está en la mejor posición de establecer ese sistema. Así que mañana va a haber oficiales del Estado de Maryland, del Departamento de Salud a nivel estatal, que van a venir a hablar con el Consejo, y eso va a ser una de nuestras primeras preguntas. ¿Qué es lo que podemos hacer para unir este sistema de registración? Porque sí, es bien complicado y es difícil de manejar, especialmente para gente que no habla inglés, especialmente para gente que no tienen capacidad de tecnología y gente también que están trabajando y no tienen el tiempo para estar en el teléfono horas esperando a averiguar si su número sale adelante. Así que necesitamos ese sistema, pero necesitamos de la ayuda del Estado para establecerlo.
Excelente, y si puedo consultarle una pregunta más. Quería saber si me puede ampliar un poco sobre la estrategia que han implementado en los últimos días de enfocarse en los códigos de área de los sectores más impactados por la pandemia para darle prioridad a esas personas de la tercera edad. ¿Cómo marcha ese plan y cómo ha avanzado la vacunación entre la población latina?
Bueno, la buena noticia es que el Departamento de Salud tiene un plan bien estratégico para establecer más vacunas en los 10 códigos que han sido, donde tenemos más casos. Y muchos de esos códigos son áreas donde hay la mayoría de la población latino dentro del condado. Eso es la buena noticia. Tenemos un sistema, pero la mala noticia es que ahora tenemos pocas vacunas que la semana pasada. La semana pasada recibimos 5,500, esta semana recibimos 4,500. Y sí es cierto que los hospitales están consiguiendo vacunas y el Estado también ha movido adelante con este lugar en Prince George's y Baltimore, pero eso no manejamos nosotros, solo podemos manejar las vacunas que recibimos dentro del condado y ahora estamos recibiendo menos todavía, así que va a ser más complicado para ayudar a nuestra comunidad y usar esas vacunas, pero eso es la prioridad.
Perfecto, muchísimas gracias.
Thank you. The next question is from Kate Ryan from WTOP. Kate?
Hey, can you hear me okay?
We can.
Okay, great. I'm sorry. I have so many questions, but let me start with, in terms of the group known as vaccine hunters, teachers who are helping others, have you all met with them? I know there was some discussion about this. They were able to get, I think, 200 some appointments out of 500 requests that they were given. So apparently they have some effectiveness there. And then second, for Dr. Kroll, what about teachers? Where do they fall in the priority? Many of them say, I want to get back in the classroom, but boy, without a vaccine, I'm nervous. So if you can, I know I gave you two big ones there, but if you can help me out on those.
I'll take on both of those. I think and just that quickly, I was focused on the teachers piece. So I'll answer that one first and ask you to repeat the first part of the question. The teachers are currently in vaccination. They're in tier 1B, tier 2 as part of the educational team, but the school system has, as part of its reopening plan, has provided us with has created a prioritization list of staff that they need to bring in based on how they plan on reopening. So teachers and educators from private school systems, I understand, are in process of also developing and providing that list. We have one of our hospitals in the area is conducting those vaccinations under the guidance from the state. So they're being provided vaccines and asking and are calling people in based on how the MCPS administration has given them the priority lists. And your first question was?
I'm sorry, have you met with, or
yes,
did you have plans to meet with the folks? Yeah.
Yes, thank you. We have met with vaccine hunters. They had a couple of very useful conversations with them. They have had some success in connecting people up with state appointments for vaccinations through the state system. They have, and we will be talking with them again, I think today or tomorrow, about how they expand their capacity, or how we make use of their capacity in helping our residents get into that system more efficiently, more effectively. Our older adults have a hard time, and I'm listening to them, to their basing this on conversations that we had. It's clear that they struggle with getting through the state's registration system in a timely enough fashion to get to a dose that's remaining. So that's one of the challenges. It's not a difficult form, it's just several pages of it. And if you're not facile digitally, or your fingers aren't working, as I said earlier, then you have some trouble. They have been very good helping us with helping our residents, and we are absolutely looking to grow that relationship and make use of them.
Gotcha. Can I get a quick follow-up there on the teachers? Should they be looking elsewhere for vaccines, or should they simply know MCPS has me in a queue? And I ask because some of them are older and do have, like I spoke to a gentleman who has a wife who is a 4-time cancer survivor he's concerned about. So
I would not tell anyone to just wait on a queue. They certainly should talk with MCPS and their management team at MCPS about where they fall out in that process. But if it's going to be a while and they see an opportunity to get vaccinated through the state system, I think it's appropriate for them to go and do that.
promise this is the last one. In terms of the allotment of vaccines, did you get them are you getting them at the same time? My understanding was you get word that Saturday night you get them and then Tuesday they actually arrive. How does that work? And again, did they tell you why the allotment was down?
They have not shared with us why the allotment is down. They simply gave us the numbers this week. And we get our notification usually, the earliest I know that we've gotten it has been a Thursday night, but more typically it is over the weekend when we get a notification of what our doses are going to be for the following week. And yes, they give us the notice and they arrive routinely on Tuesdays. I do know that some of the other providers get noticed at different time frames and delivery at different time frames.
Thank you very much. I appreciate it.
Thank you. Our next question is from Carla Flores from Telemundo, and she has some questions in Spanish for the Council Vice President. Carla?
Hi, buenos días. Déjame mostrar mi video quick. Ok, ¿me puede escuchar?
Sí.
Sí, perfecto. Quería hacer una pregunta acerca de la orden ejecutiva sobre los restaurantes y cómo están lidiando con eso, porque yo sé que el gobernador Hogan dio un mandato, pero ustedes todavía quieren como seguir con lo que ustedes tienen internamente. ¿Hay planes de cambiar eso?
Gracias por esa pregunta, Carla. Sí, mañana el Consejo va a revisar y votar en el orden ejecutivo que mandó el Ejecutivo para abrir restaurantes este domingo, empezando a las 7 de la mañana, con una capacidad de 25% dentro del restaurante. Y también va a subir de 1 hora a 90 minutos el tiempo en que uno puede estar dentro de un restaurante, pero va a seguir el orden como lo mandó la semana pasada, que a las 10 de la noche va a parar la venta de alcohol. Pero en eso vamos a votar mañana y vamos a ver si va a pasar o no.
Perfecto. Tengo una más. Acerca del número del hotline que ustedes tienen en el condado, ¿ese número también está sirviendo a la comunidad hispana?
Sí, también está sirviendo a la comunidad hispana.
Perfecto. Ok, muchas gracias.
Thank you. Next question comes from Heather Curtis from WMAL. Heather?
Hi, can you hear me okay?
We can.
Wonderful. Okay, so when the governor toured Six Flags last week, he said that more mass vaccination sites would be opening this week. Has he said anything about whether any of those will be in Montgomery County, since, as Council President Hucker said, it is difficult for people to get to Six Flags, especially those without cars or with disabilities?
Dr. Kroll?
Responding to a little emergency we just had. Could you repeat, please?
Oh, no problem. So last week when the governor toured Six Flags, he said that more mass vaccination sites would be opening this week. I'm wondering if any of those could be in Montgomery County, and if not, if he said anything about when one could open in Montgomery County, since as Council President Hucker said, it's difficult for people, especially without cars, to go to Prince George's County to get their vaccines.
I know that we have broached the topic about having a mass vaccination site here in Montgomery County. To my knowledge, he has not made a commitment one way or the other on that at this point.
And I have one more question, if you'll indulge me. So last week, Council President Hucker, you said Montgomery County was vaccines per capita than smaller counties.
Heather, I don't think we can hear you too well. Can you adjust your microphone?
Oh, yes. Can you hear me better now?
Yes,
Yep.
we can. Thank you.
Sorry about that. Thank you. So last week, Council President Hucker, you said that Montgomery County was getting fewer vaccines per capita than smaller counties like Carroll. It seems like that's still the case. After you said that, the governor and County Executive Elrich met. They said they had a productive meeting. Did they talk about why the county's getting fewer doses per capita and if there's a plan to address that?
They did. What I wasn't in the meeting, but what I understand is that the state has continued to say that, look, they are not getting all the doses they want from the federal government, and they're trying to stand up a response that gets as many doses into a number of different, obviously private providers and others. But it still doesn't, to my knowledge, I haven't heard a straightforward answer to the question of why not just Montgomery, but Prince George's, Baltimore City are getting fewer doses per capita than many smaller jurisdictions. Dr. Kroll, Gabe?
I think you've covered that. It's not clear yet quite what the distribution is based on and how we go about getting a more equitable distribution.
And we have stressed, and we will stress tomorrow when we meet with state representatives, that it's not being taken sufficiently into account that we have 6 regional hospitals here, that almost 40%, our understanding is, of the workforce of those hospitals don't reside in Montgomery County. So the people that are getting those vaccinations don't count against our county residents. And when you also factor in the percentage of population we have over the age of 65 and of course 75 as compared to the rest of the state, and the fact that we also have a very large minority population here, we think that it's imperative for the governor to shift course and allow us to receive a higher percentage of dosages so that we can get to these populations that desperately need those the vaccines.
Thank you so much.
And Heather, I would just add, I've talked to so many constituents on the phone and on social media and other things who have pointed out that Montgomery County has vaccinated a smaller percentage of its residents than many other counties, and there's even been some reports about this. This contributes directly to that problem, and it's sort of an unfair comparison because even if we were getting our adequate, a fair, equal amount of doses per capita, it's a lot easier for Garrett County with 30,000 people to reach 10% of their residents, because you only need to vaccinate 300 people before than it is for Montgomery County to get vaccines in the arms of 100,000 residents to reach 10% here. So there's an unfair comparison that our residents are unfortunately being confused by, but it is greatly exacerbated by the problem that, as you said, we are not getting our fair share of doses.
Thank you so much.
Stephanie Ramirez is back with us with her follow-up question. Stephanie, go ahead.
Thank you. Sorry, no dog anymore. Just a question to Carla's question in Spanish, but in English. If you could just confirm, I think I heard you say that the council's looking at extending when to reopen indoor dining at 25%, and also extending 60 minutes now to 90 minutes. The question I would ask is, what is the county council looking at that you are proposing these extensions compared to what the council, the county executive has proposed?
Sure. So the county executive amended the public health executive order that he originally passed to the council last week to reflect those 2 changes. One, that the effective date, rather than be Tuesday, be Sunday, February 14th at 7 a.m. And The other difference between the original executive order is that there be a cap of 90 minutes as opposed to 60 minutes of dining. But there is still a cap of 10 p.m. For no alcohol service. And we'll be taking that up tomorrow. And it's important to note that as the Board of Health, basically what that does as the council is it ensures enactment of the policy across the entire county to include our municipalities. Our public health officer and the county executive have the ability to move this executive order without the support of the council. It just would mean that it would not technically cover the entire county. And so that's the role that we play in coming in and verifying the public health executive order and recommendation from our director of public health.
And do you all agree with these recommendations, and what specifically, are the metrics that you're looking at that you are saying yes or no?
Well, I can't speak for all my colleagues, but speaking for myself, I am going to support the amended executive order as it came over. I think that it gives us a little bit more of a runway to confirm that the numbers that, as the council president noted at the beginning and have been going down, stay down, and that it also gives restaurants an opportunity to be able to prepare and plan rather than just immediately, voting and then deciding that same day that restaurants will open. This gives them a little bit more runway to be able to ramp up their operation to open effectively.
Okay, and one last question from Kate Ryan.
I appreciate that. I am looking at a tweet from Mike Ricci, the communications officer for Governor Hogan, and he says, in terms of utilization of first doses, that Montgomery County is around 20 out of 23 localities here, again, in vaccines administered as a % of delivered first dose. Can you all talk about that? Does that get back to what you were saying, Mr. Hucker, on population?
I haven't seen the tweet or know which data he's referring to, Kate, but that sounds like a surprise to me if it's as you describe it. Dr. Kroll, do you have anything to?
No, and actually, I'm surprised. I was just trying to see how quickly I could get over to my Twitter feed to see, but I'd have to see what he's referring to be able to.
I apologize. Yeah, they say, again, according to this, and it's not clear exactly where this is coming from, but that 80% of those vaccines delivered have been administered in Montgomery County. Does that match up to what you've?
That if assuming that is across all sources of vaccination, that seems probably likely correct. The county, our administration process is typically running 90 to 98% of our doses administered, to 100% of our doses administered. But when you add them all together from hospitals and pharmacies, et cetera, that may be, that could well be accurate.
Okay. I see. Thank you.
I will say, Kate, the tweet's interesting. I think that, the session that we have tomorrow will be, I think, a very important one for us to be on the same page with the state, because, there does need to be strong collaboration moving forward. And one thing I failed to mention in my opening comments, which I should have mentioned, is we are seeing a rise of scams, both in our county and our region, related specifically to the virus, because this is a scam artist's, dream. All these, the confusion that's out there, the level of desperation that's out there. And so we're working with our Office of Consumer Protection, and there'll be more information in the coming days on what the county will be doing to address those issues. But that is yet another example of where we're going to need to collaborate with the state. And I'll also mention too that it's critically important for us to continue to coordinate as a region. We obviously get a specific allotment through our state, but there has been collaboration and coordination on a number of different levels regionally, and that's going to need to continue moving forward.
Got it.
Yeah, and Kate, I'm reluctant to comment on a tweet without a data source that I just saw, but now it's being forwarded to me. It's very confusing because week after week, Montgomery County was ranked first in the state among all counties at efficiently delivering doses to to our residents, speaking for the doses given to our health department. And this little infographic has 7, I think, counties that are over 100%. So I'm not sure how any county is even if they're perfect, can deliver more than 100%. So without a citation, it's very confusing, but
Right.
it's certainly uncharacteristic to what we've seen in the past. And of course, Governor Hogan specifically recognized Montgomery County for our efficient delivery system at one of his previous press conferences.
Got it. And again, just to jump back on the mass vaccination sites, nothing yet scheduled. Have you been notified by the governor's office on the possibility? And would you request one for Montgomery County?
We have requested using the fairgrounds.
And did you get a response to that?
Nope.
Thank you.
Okay, we have a follow-up question from Rebecca Tan. Rebecca?
I just wanted to clarify. So Dr. Corral, the tweet that Mike Ricci just put out does say that this is just specific to the county health department. So from what you know, can you tell us right now what percentage of the county's vaccine doses that is the responsibility of the county government have been administered, first doses?
Overall, I'd have to go back and look. I don't have the data in front of me, so I'd have to go back and look just to be sure. It probably depends on what they report versus what we report. Depends on when they decide to take the measure. If they give us doses on Tuesday, we don't start putting those doses out until Wednesday. So if they're reporting this data as of Friday or Saturday, it may not reflect that we haven't had a full week to put out the doses. So over week over week, we consistently put out all of the doses that we have. So we're always above 90, 95, 98% of our doses administered that they've given us for the previous week. So if they've taken the measure on a Friday or a Saturday and reporting it that way, it may show up as a lower number.
Got it. Thank you. Appreciate it.
And our last question today will be coming from Afrique Today. So you may ask your question.
Hello, the president and the vice and Mr. Crowd. My question is that the county have any strong outreach capacity for the vulnerable community here on the East County, especially White Oak to Brittany, who we know is a very diverse community, French speaking, English, and different language. So the county have any strong outreach? So because those communities are dismissing the vaccine, and we really want to find a way to empower and outreach, strong communication, so people can get out and get those vaccines and to save the community.
So yes, I mentioned it in my initial comments that we are working with what was formerly the census team, coordinating team, but specifically now working on that with that group to reach out into the communities of color and where there's language diversity as well. We are working very closely with Jeru Banda, who is the director for the East County Regional Service Center, as part of that process to make sure that the languages that are represented in East County and the communities that have different languages, speak different languages in East County are reached out to as part of this process. So that is a continuing work in progress all across the county, but East County is definitely one of the locations where we will be. We're aware of the need for various languages that are spoken by the African community, the Ethiopian language, Amharic, French Haitian, or French as well. So as we roll that out, we will be doing that in language appropriate and culturally appropriate ways.
And then to finish, is there any way the Adventist Hospital will play any big role for vaccination in the community as a term of a facility, for White Oak all the way to Brittany to Burtonsville? Because we know there's only one big hospital we have on Viva White Oak, around here. Is there any way they can be using as a capacity space for vaccination?
We have been in conversation with them about doing just that, using some of our information about who's in the community and where they need to be reached out to, as well as encouraging them to, I believe the state may be encouraging them to do that as well with doses that the state is providing. So it's a conversation that is not done yet, but I'm optimistic that we'll be able to reach an agreement that allows us to do that, to use them as part of a larger vaccination effort.
Thank you so much.
Okay, thank you very much. That's going to wrap up our media briefing for today. Thank you to all the reporters and members of the media who came out today. And also thank you to Dr. Kroll for being with us. Have a great day.
Thank you all.
Thank you.
Thanks.